Women's Health Leadership promotes health and social justice by supporting grassroots women leaders. Women's Health Leadership provides a grassroots solution to health disparities and other issues by enhancing the talents of natural community leaders through training, technical support, relationship building, peer learning, and mentoring in a supportive cross-cultural environment. These trained leaders, in turn, advocate for solutions that are community-driven and relevant. Over 300 women from 46 of California's 58 counties now make up the movement called Women's Health Leadership, with more joining each year.
California is one of the most diverse states in the country, the Ellis Island of the 21st century. And healthcare systems, even when they think about maybe hiring one translator for a particular language, are now encountering that they have to hire translators in up to 40 languages, just to be sure that they're reaching the communities in an effective manner. The healthcare system has been really trying to figure out how to reach out to groups and populations that live in their communities but often don't show up at their doors unless they show up at the emergency room.
Meanwhile, more and more new voices are being heard. They are persistent voices, voices in many languages but with one real message. They say, "We can help. Let us lead."
Dedicated but all too often isolated, there are women leaders, emerging role models, who want to strengthen their own leadership skills. They want to build on their own innate abilities and improve healthcare services for women and families. They believe it isn't necessary for disenfranchised, lower income, and minority women and families to suffer, to remain alienated. There is a way to connect the dots, to tap community-based leadership, and to join local residents seeking to expand their capacity to nourish and heal communities.
As chair of the Senate Health Committee, this program is absolutely essential to guide us as we're making policy. I don't know what I would do without a program of this caliber, of this value, of this significance, of the on-point direction that it provides us.
Women's Health Leadership features a proven set of powerful tools and processes that build on the inherent skills of participants to strengthen and encourage the emergence of better grassroots leadership. The core objectives of the Women's Health Leadership Program are to build leadership capacity of community leaders who are providing solutions to social justice and health disparities, to foster community-driven policy and decision-making by mobilizing women working at the grassroots level, to enhance the use of technology by grassroots leaders and their communities for networking and learning, to create and support a movement of grassroots leaders working to increase health quality at the local level. All across the state of California, empowered by their training, WHL alumni are making a difference, building bridges of understanding, connecting grassroots know-how to better health policy and improved programs. They lead by their example, and here are some of their stories. In remote Northern California, working with Native American tribes, WHL alumni Norma Pohl McAdams and Anita Bussell now lead projects confronting critical health issues such as diabetes, obesity, drug abuse, and safety.
If it weren't for WHL, I don't believe that the things that have been accomplished in the last couple years would have been accomplished.
Now state certified as a safety specialist, Norma recently represented 103 Native Indian tribes in Washington, D.C., where she received funding for child protective seats and support for safety awareness programs much needed in her community.
They're dying 3 to 5 times more than any other race. So that's why it's so critical that we have a strategic plan in implementing interventions in injury prevention.
I have taken back trainings that I have received from WHL, and I have repeated them and worked with other women and encouraging women of this community here that they are leaders.
They came from Afghanistan, and they are under stress and depression because these seniors, they lost their families, and they spend their life lonely in their home.
Strengthened by her WHL Leadership Development Plan, Nadja was able to realize her dream of creating a weekly gathering of Afghani women in Fremont, California. It's a welcome place for the women to study, build community, sew, and exercise.
Well, I would say 100% of them live in small apartments, and they're not able to get out of the house because they don't speak the language and they're afraid of getting lost, even to go for a walk. So many of them are essentially homebound. And so that's what's happening now, is they are being led by their own member in exercise, and it's pretty exciting to see them develop this on their own.
WHL gave me more power to be brave and work in my community.
I become a new person. I no longer hesitate to talk to people to find out what is available for my plan or my idea for my project.
Serving Southeast Asians in the Long Beach area, Shannon Hobson now organizes classes in ESL, safety, and job readiness. In addition, she coordinates cultural and recreational activities that are alternatives to gangs, such as this annual sandcastle competition in Long Beach.
So right now, I'm sure that I can do it. I can lead people, and I can lead the kid to grow and to become a leader in the future.
As the director of a national organization that encourages women to start projects in their local communities to decrease infant mortality, I think that the women who have gone through WHL that are project managers in California have come back knowing how to run their projects. They have better leadership skills. They're connected to other people and resources that can help them. They have a strategic plan. And most of all, they have confidence. They know that they can go out and do what needs to be done.
Also, having been through the curriculum, many WHL graduates demonstrate a better awareness of how their efforts can connect to improving public health policy.
The way the WHL program works that's different is that it increases community voices. It gives women an opportunity who may not have thought of themselves as leaders to be comfortable in their voices and their opinions, and to see how those are valuable in informing their organizations around the state, their programs around the state.
The faces and the demographics of women's health leadership represent the diversity of California. So when you're talking about issues of cultural competency and being relevant at the community level, you have to have those faces and voices at the table, driving those decisions that get made, developing those policies that are influencing a multitude of communities and the general public.
It's important that people understand and learn how to access the system.
Through her efforts to ban alcohol and tobacco billboards disproportionately targeted to Black and Latino communities in Los Angeles County, Chris Bailey has made an impact.
Well, the city of Compton is striking back against negative images in that community. The target here, billboards displaying alcohol or tobacco ads.
We have a problem with the alcohol and tobacco industries coming into our communities and specifically targeting our kids with their product, which we know is deadly.
The Black Women's Media Project gathered 500 petitions, helping the Compton City Council become the first in the nation to ban billboards with ads for alcohol and tobacco.
I think it's important that some of the fear and apprehension is taken out of the process of being involved in government and making changes, especially as it relates to women's health.
Clearly, we can see now that alumni from the program are continuing to work together. They're continuing to receive support from each other, continuing to receive resources from the program to take their work deeper in the communities. In fact, some of the alumni are even replicating the Women's Health Leadership Program in their respective neighborhoods and communities in other languages. And this is allowing women's leadership not only to impact 300 women who have been part of the program, but thousands of women across California.
It's so excited to think that this is going to connect us, that the language is not going to be a barrier, you know, that we can connect through our own languages, and those that are bilingual can make the next connection to the rest of the women.
Replicating the WHL training model for her individual learning project, Virginia started a training program for monolingual and bilingual women in San Diego. This is Alma Avena. Since Virginia's training, Alma works to promote family literacy and is also a promotora for Healthy Families, a low-cost insurance plan available for California's many uninsured residents.
She has really grown and changed by learning English, taking the initiative to learn new skills, and to really take a lot of other women under her wing and to empower them and give them the skills to become more involved in the community and in their children's education. You can actually hear other community residents walk around, and I've heard them actually say, my goal is to be like Alma.
Not just as an immigrant, but as a survivor of domestic violence. My learning project was, and I did workshops in domestic violence. I was also determined to start replicating women's health leadership in the Latino community.
At a recent ceremony in San Pablo, California, 15 women graduated from a year-long leadership program, during which they initiated a range of neighborhood-based, health-related organizing projects.
Fue poder lograr un proyecto de principio a fin. Hemos aprendido muchas cosas, hemos pasado momentos maravillosos y momentos difíciles.
I'm proud of my mom because I see every day how she has grown, and I mean, just seeing my mom working so hard every day, and just doing this for other people, it's just amazing.
In addition, Women's Health Leadership alumni are also sowing seeds for grassroots leadership in other ways, such as programs for girls.
The Women's Health Leadership cemented women to begin with to start this in Salinas. I see them go on and doing things that I just think are so wonderful, and we were committed to making it happen.
Based in the Salinas, Monterey area, Diane Norby helped to start a teen girls program named ECHO for promoting education, career, and health opportunities.
I have a friend that she got pregnant really young, and so she couldn't really like do things that she wouldn't want it. And to me, like being in the ECHO program, like really made me realize, you know, like I can do anything. I can be and like anything I want to be.
Before I got into this ECHO program, like I knew like some about like college and all that, but then like by being in this, I learned a lot more about how to apply for scholarships and like all the deadlines and stuff.
Recently, the girls went to the state capitol to learn firsthand how public policy is made and their potential role in shaping it.
I've never been in a program like this. This is only about girls our age, teenagers, and these are respectable women with good jobs that I've never ever been around, and they're paying attention to teenagers.
Like a classroom without walls, this training program is a chance for emerging local leaders to build on their own life experience, help their own people, and gain practical educational training without returning to or entering a college institution.
Part of the desire and part of the leadership skills that this program is able to really foster in the women who come through the program is an ability to walk both worlds. It's an ability to create a bridge between the healthcare provider system, who does really want to do a much better job, and those women out in the community who have never had the opportunity of coming in for healthcare in the past.
The Women's Health Leadership Program is one of the few programs that actually identifies women who represent California, grassroots, women, working class, new immigrants from a broad spectrum of ethnicities, and puts them in a leadership setting that trains them to train the policymakers, which is an incredible model. It is the model that is truly representative of California, and it's a great resource.